Before we begin, comment your name and state below. I really want to see who's smart planning ahead and who's just scrolling by. I love seeing who's actually paying attention and taking notes because what we're about to cover can directly affect your coverage, your care, and your pocket in 2026. Now, big news first. UnitedHealthcare, one of the largest Medicare Advantage providers in the nation, just announced major changes for the 2026 plan year. They're exiting over 100 counties across the U.S. That's right, UnitedHealthcare is scaling back coverage areas, particularly in certain rural counties and lower-density regions where costs have climbed and margins have tightened. They'll still cover about 94% of Medicare-eligible Americans, but this is the first time in years we've seen UHC make such a wide-scale retreat. Why? Rising healthcare costs, more expensive utilization, and tighter reimbursement from CMS are forcing insurers to rethink where they operate. And that means for millions of Medicare beneficiaries, especially those on UHC Advantage plans, 2026 might be the year they need to shop around again. Now, if you're new here, let's take 30 seconds to get everyone on the same page. Medicare Advantage, also called Medicare Part C, is an all-in-one alternative to Original Medicare. It combines Part A, hospital, Part B, medical, and often includes Part D, prescription drugs, plus extras like dental, vision, and hearing. Instead of Medicare paying your healthcare providers directly, it pays a private insurance company to manage your care. The advantage? Convenience and sometimes lower premiums. The trade-off? Limited networks, prior authorizations, and plan rules that vary by area. So when we talk about the top 10 Medicare Advantage plans, we're really talking about insurance carriers whose plans consistently perform best in CMS Star Ratings, customer satisfaction, provider access, and value for money. For 2026, these ratings are based on data from the Centers for Medicare and Medicaid Services, combined with consumer feedback and overall stability of each insurer. Let's jump right into the list, and keep in mind, this is a national overview. Specific plan options vary by zip code, so your local lineup may look a little different. Number 10 on the list is Highmark Blue Cross Blue Shield. Known for strong customer service and broad regional networks, Highmark continues to rank among the top performers in the Northeast and parts of the Mid-Atlantic. They've earned consistent 4-star ratings on several of their PPO and HMO plans and are especially popular among members who want reliable access to both local doctors and large hospitals. At number 9, we have Cigna Healthcare. Cigna's Medicare Advantage growth in recent years has been impressive, and for 2026, they're expanding their footprint in key states like Texas, Arizona, and North Carolina. Their plans usually feature low or $0 premiums and excellent preventive care programs. Cigna has also added new supplemental benefits for 2026, like transportation and grocery allowances for certain chronic condition plans. Number 8 is Molina Healthcare. Molina doesn't always make the national spotlight, but their plans perform very well in specific regions. In 2026, Molina's star ratings improved in multiple states, and they're becoming a serious player in affordable HMO options. Their focus is value, fewer extras, but strong medical coverage and predictable costs. Number 7 goes to Anthem Blue Cross Blue Shield, now part of Elevance Health. They've restructured several plans for 2026, cutting back on unnecessary extras to focus more on core health benefits. Their PPO networks remain among the largest in the country. Anthem's consistent 4-star average rating keeps them a reliable choice, especially in states like Georgia, Ohio, and Indiana. At number 6, Centene's WellCare continues to hold a strong position. WellCare has spent the last few years improving member experience and addressing pharmacy network complaints, and it's paying off. For 2026, WellCare's expanded benefits include more flexible dental coverage and higher Part B givebacks in select areas, meaning you could see part of your Medicare premium refunded. Now, before we hit the top 5, if you're finding this information helpful, take a second to like this video and subscribe to the CareWise channel. We post Medicare and Social Security updates every single week, and staying informed can literally save you hundreds, sometimes thousands of dollars a year. Alright, number 5, CVS Health's Aetna Medicare Advantage. Aetna has one of the largest and fastest growing networks in the country. Their 2026 plans are highly rated, many in the 4.5-star range, and they're introducing new virtual care features for routine visits and chronic condition management. Aetna's reputation for customer service and affordability keeps them high on the list year after year. At number 4, Kaiser Permanente remains a standout. Although Kaiser's plans are only available in specific regions, like California, Colorado, and parts of the Pacific Northwest, their integrated care model consistently scores 5 stars in multiple states. Kaiser's member satisfaction ratings are unmatched. If you live in a Kaiser region, it's easily one of the best Medicare Advantage options out there. Now for number 3, UnitedHealthcare, yes, the same company that's exiting certain counties in 2026. Despite those changes, UHC remains a dominant force nationwide. They still serve millions of Medicare Advantage members and offer strong plan designs under the AARP brand. Most of their remaining markets continue to perform at 4 stars or higher. Their Smart PPO and Chronic Complete plans remain popular for those who want flexible access and robust supplemental benefits. But, and this is important, if you're in one of the counties where UHC is exiting, you'll need to review your options this fall to ensure continuous coverage. Number 2, Blue Cross Blue Shield Association plans. Across 35 states, local BCBS affiliates are offering some of the most balanced Medicare Advantage options available. These include Anthem, Independence Blue Cross, Florida Blue, and others. The power of these plans lies in their local control. They tailor networks and benefits to the needs of their communities while maintaining national-level stability. Many of these plans carry 4.5, and even 5-star ratings for 2026. And finally, the number 1 spot for 2026 goes to Humana. Humana has continued to dominate Medicare Advantage rankings, both in enrollment and member satisfaction. For 2026, over 60% of Humana's MA members are in 4-star or higher plans. They've also expanded their zero-premium HMO and PPO options and are focusing on improved dental, vision, and hearing benefits. Humana's Smart Summary transparency tools and their push toward preventive care and fitness incentives have kept them leading the pack. Even after UHC's partial exit, Humana is expected to pick up a substantial portion of those displaced members. Now, let's zoom out a little. The 2026 Medicare Advantage landscape is changing more than it has in the past decade. UnitedHealthcare's county exits are a big story, but they're not the only one. CMS is tightening rules on prior authorizations and provider access, forcing insurers to prove that their plans deliver real care, not just cost control. At the same time, smaller nonprofit carriers like Priority Health and Martin's Point are outperforming expectations in regional star ratings. For you, the Medicare beneficiary, this means more choice, but also more responsibility. Don't just stay with the same plan out of habit. Check your annual notice of change this October. Review your network, your drug coverage, and your out-of-pocket maximums. What was a good deal last year may not be next year, especially in areas where plan networks or benefits are being realigned. The good news? CMS data shows that the majority of Medicare Advantage plans for 2026 continue to offer $0 premiums, and over 70% of enrollees are in 4-star or higher plans. That's a record level of quality across the board, even as the industry faces cost pressures. And before we wrap up, let me give you a little teaser. Our next video is going to break this down state by state. We'll look at which plans perform best in your area, how star ratings differ by region, and which states are benefiting most from the new 2026 plan expansions. So make sure you're subscribed with the bell turned on so you don't miss it. Remember, Medicare Advantage isn't one size fits all. The right plan depends on where you live, what doctors you see, what prescriptions you take, and how you use your healthcare. Take the time this fall to compare your options, and do it with accurate, up-to-date information. That's what CareWise is here for. So, comment your state below. I want to see where everyone's watching from, and tell me if you're planning to stick with your current plan or shop around for 2026. Let's see how many of you are thinking ahead. Thanks for watching. Stay informed, stay proactive, and I'll see you in the next one.